Welcome back to Awaken with Me, helping you become aware and empowered on all things health and wellness on your health and healing journey.
Hello, and welcome back to Awaken with Me. Today, our guest is Lucinda Sykes. She's a Canadian doctor who loves helping women get better sleep after 50. Her Toronto clinic, Meditation for Health, has taught therapeutic programs of mindfulness for more than 20 years. And online, Lucinda collaborates with a nutritionist to offer an entirely holistic approach that cultivates deep, natural sleep throughout the second half of life. Welcome, Lucinda. I'm so glad to have you on Awaken with me.
Why, thank you, Nick. I'm very glad to be here. Thank you for the invitation.
Sure thing. So let's start by you telling us a little bit about yourself and how you got started in women's and alternative health.
Sure. Well, it's kind of a lengthy story, but I'll shorten it. I've been practicing medicine for decades now, and since 1997, I've been teaching medical programs of mindfulness. I have a clinic in Toronto called Meditation for Health, and we've taught thousands of people programs of mindfulness based stress reduction. They've been sent to our clinic with quite a wide range of problems, such as anxiety and sleeplessness and chronic pain and so on. As you may know, I'm sure you do. Programs of mindfulness, especially mindfulness based stress reduction, are very effective in helping many people deal with chronic illness. Uh, but then when COVID struck a couple of years ago, I was sort of left at loose ends. I was right in the middle of teaching a program, and by gosh, we had to stop because,
Mhm.
of course, we couldn't teach while the pandemic was raging. So I began to go online, and I've really enjoyed being online. And I've brought my particular focus of women over 50, I've brought that online and with special attention to the concerns of women who cannot sleep.
Mhm.
And I have a colleague in this, a holistic nutritionist, Carol Arist, and we have been teaching group programs to help women over 50 get better sleep. So I don't know if I'm going to go back to in-person teaching. Nick, I'm really enjoying the online world, meeting people such as yourself from really around the world. And I find that it is possible to teach effective mindfulness for people, even when we're not in the same room.
Yeah, that must be so exciting to be able to expand your program too, and like get to meet the needs of people who aren't within your local
Yes, yes,
vicinity.
yes, it is exciting. It's a new dimension to my work. I've been looking, in particular, I'll jump right to the point. I have a particular interest, Nick, in alerting women to the risks posed by short sleep, not getting enough sleep, and also by a dependence on sleeping pills. And I want them to know that the research is there, and we're talking now numerous research studies that show that women who don't get more than 6.5 hours sleep, if they're not getting more than 6.5 hours sleep, they are really at risk for cognitive decline. Now that's a fancy term for, well, we think of dementia and Alzheimer's disease. It's
Yeah.
pretty scary to talk in those terms, but that's what the research points to, that women who aren't regularly getting at least 6.5 hours of sleep are really at risk for these conditions. And their risk is even worse if they are dependent on nightly sleeping pills. Often that gets overlooked. When I began to read this research a couple of years ago, I must say I was shocked to
Hmm.
realize how serious the risk is and how it's not widely known. So I did want to get the message out.
Yeah, that's so interesting because we hear all the time how important sleep is, but to think about it, especially as it relates to women, right? Because what I'm learning is that, like we're all humans, but women's health and men's health differ in many ways.
Most certainly. That's why I've now focused to women, because I find the groups are more effective if I am teaching women.
Hmm.
And I'm especially concerned to help women keep their clarity of mind. As we pass through the second half of life, we are more and more concerned to keep the clarity of our mind. We know that we are at risk of losing our memory and losing our capacity to think clearly. And, many women get into advanced years, into their 90s, still very sharp of mind. But the evidence is that if you are not getting sufficient sleep,
Hmm.
and if you are taking nightly sleeping pills, you are running the risk of losing your clarity of mind.
Yeah, I'm glad you mentioned that. Can you tell us a little bit about your what's your definition of mindfulness? Because I know that's a lot of your focus.
Yes, good question. Good question. When I first started teaching it back in the 90s, people didn't know much about it, so there wasn't much confusion. But these days, it seems like every second practitioner has a different definition.
Hmm.
Now, I'm using the definition that I got through my years of training at the Center for Mindfulness at the University of Massachusetts. So, some of your listeners may know that John Kabat-Zinn, who developed the mindfulness-based stress reduction program, he was affiliated for many years with the folks at the Center for Mindfulness at the University of Massachusetts. And I went down there. Gosh, it was 20 times, I think I went down for various training programs and academic events. And their definition is 4 simple points. Okay, they're bulleted points, but I can't present them to you visually, but I'll just articulate them for the listeners. The
Hmm.
first bulleted point is mindfulness means that you are paying attention. The second bulleted point is on purpose. So mindfulness means that you are paying attention on purpose. And the third bulleted point is to your present moment experience. So, mindfulness means that you are paying attention on purpose to what you're experiencing right now. And crucially, the fourth bulleted point, the final bulleted point, tells us your attitude. You are paying attention on purpose to what you are experiencing without needing to judge it or change it. So, that fourth bulleted point is crucial. You are not trying to get something to happen. You
Hmm.
are not judging your experience. You're not trying to make it change, but you are paying close attention. Now, Nick, sometimes that means that when we're practicing mindfulness, we're aware of judging thoughts, and
Hmm.
we can witness the judging without needing to judge the judging.
Hmm.
Yes, so important, because sometimes people get confused. They think that mindfulness means being aware without judging. But gosh, as modern women, many of us, even most of us, have a lot of judging. That's how the mind is. The modern mind does a lot of judging. And so when you're mindful, you can notice how you're judging yourself. Maybe you're even judging your meditation. You're thinking it's not working and so on. And you can witness those thoughts too without needing to judge them.
Thank you so much for that definition and explaining it because you're so right, especially in this day of social media. There's so much judgment because of the whole, wanting to be accepted.
Yes.
So we're constantly judging ourselves. And I'm glad you mentioned that point of like, even when you are doing meditation, not to judge yourself.
Yes.
Um, yeah, I think
Yeah.
that's such a good point.
I like to emphasize it for people because you see, mindfulness meditation is a liberation. You get to be exactly as you are. You do not need to make it be a certain way. So when
Mhm.
I hear people say that they're trying to be mindful, I know immediately that they're judging themselves. They're judging that they're not being mindful, and it's a bit of a joke. You
Mhm.
can be present to yourself just as you are, even if your mind is busy and you're feeling a little anxious and stressed. So be it. This is your present moment experience.
Yeah, and it's hard because it's more about acceptance, right? And giving
Yes.
ourselves permission, which a lot of
Yes.
times we struggle with.
Yes, yes, that wonderful word acceptance.
Yeah.
We emphasize that in our programs. Acceptance meaning that we don't need to agree with things. We don't need to say, "Isn't it wonderful? I feel this way." No, acceptance means, however, that you are letting things be as they are. So you're not trying to change things, you are allowing them to happen. So you're accepting that you have a headache right now, or you're accepting that you're feeling stressed right now. It gets to happen and you don't need to fight with it. And we like acceptance because when we're practicing acceptance in this mindful way, well, gosh, that's when the mind gets a chance to relax. We're told that this is a way to bring relaxation to the mind, which is simply to accept whatever you are experiencing right now. In fact, the mindfulness teacher Gregory Kramer uh, writes in his book that acceptance is to the mind what relaxation is to the body. If you want to relax your mind, practice accepting the moment as it is right now.
A big part of taking better care of yourself is becoming more self aware and how you show up in different spaces. And that includes in your diet and your eating and just your health overall. So be sure to check out the self awareness quiz on my website, www.awakentoyourpassion.com. It will have a series of questions to help you do a deep dive to become more self aware.
What are some of the health changes for women after 50? And are they really normal, or are they things that we can have some kind of control over, especially as you mentioned before, if you're practicing better sleep, you are lowering your chances of declining your cognitive health.
Yes, yes, wonderful questions. So let's just at the outset recognize that in mindfulness, we use the word acceptance in a very particular way. So, that definition I gave you of acceptance, allowing the moment to be exactly as it is,
Hmm.
that's one way of talking about acceptance.
Hmm.
But on the other hand, in everyday life, there's lots of things we don't accept. Like right now, I have to do some laundry soon, and I'm going to get up and do the laundry because I will not accept that I have a bag of laundry in my living room.
Yeah.
I want to get the job done. So I'm using the word acceptance in we call it the popular way instead of in the mindful way. And your question is, of course, a popular question. You're asking, these changes that your doctor's pointing to are. Do we need to accept them as natural, a natural part of aging? Now, I don't know what changes that the doctor is pointing to, but you see, I'm well into the second half of life now. And ladies, I can assure you that it's wonderful. I can assure you that. But it's true, in the earlier decades, you can be kind of taken aback that you're going to get wrinkles and all these physical things are going to happen and you'll be closer to death and it all seems kind of disturbing. But fortunately, you're going to have years to grow into it.
Hmm.
Years and years. And it's all natural. This is our destiny as human beings. My organization at the clinic, we call it Joyful After 50. We
Hmm.
have programs for women over 50, and we're focused on the joy of being alive. And so acceptance comes in there because if you are practicing acceptance in this mindful way, well, really, whatever you're experiencing, you can allow it to happen, including your judging mind and your wrinkles, and so on and so on.
Yeah, and I'm glad you brought that up because, like certain things are different. Like I'm talking more about like pains. I was really having like serious pains
Oh,
and um like even some of those other things like I've learned like to myself now based on personal experience that they aren't necessarily normal. um
no,
like
no.
digestion issues, gut health issues, constipation, that kind of thing. Like,
Yeah.
I don't think they're normal.
Yes, I could understand that you don't want to accept those matters. Like I say, I don't know what the physician's referring to, so I don't
Yeah,
know
yeah,
what needs to be accepted. I will tell you that your skin is going to wrinkle. So
yeah.
that that one we can count on, and your vision will not be the same.
Hmm.
And you maybe won't be able to walk as far as you used to. So those things, you get to accept them. But
Yeah.
on the other hand, there are many matters that you don't really need to accept. Well, for one thing, I was giving you the idea that if you take care of your brain, you may not need to accept uh, dementia. That
Hmm.
if you take care of your brain, if you get enough sleep, if you eat in a careful way, that you may be able to keep a very sharp mind even into your 90s.
Hmm.
So there's a thing that we don't necessarily need to accept.
Yeah,
You know, Nick, I'm just when I was at your website and I saw you were quoting Carl Jung on
yeah.
the homepage there, and I was so moved to see that because, of course, I've been studying Jung for a long time too. I admire him as I suspect you do. He
Yeah.
gave us the idea that life has two stages. He called the first stage the morning of life, and the second stage he called the afternoon of life.
Hmm.
Now, I'm in the afternoon of life, and it sounds like, in a way, you're in the morning of life.
Hmm.
And he points out that in the afternoon of life, the rules get changed, that the way we guide ourselves in the second half of life naturally changes. It's not the same.
Hmm.
It's not the same.
Hmm.
And that's in part why I've really focused these days to the ladies over 50, because I like us to be working in the same, shall we say, toolbox, the same worldview, which is the worldview of the afternoon of life.
I mean, we're gonna get there.
Oh, you
It's
will.
it's
Yes,
just
you
like the
will.
the natural path of life.
Yes.
Um, so I wonder, what role does food play in health, and does that change um after 50? And if so, how so?
Well, I would advise women over 50 to be conscientious about the way they eat. Maybe in younger years, they, dabbled with this and that and so on. But in mature years, again, you really are encouraged to take care of your brain. That is so important. And there is increasing evidence now that your dietary habits affect the well being of your brain. For one thing, we know that it's very good to eat lots of leafy greens
Hmm.
and vegetables too, more broadly. That the brain likes these foods, and you can give fancy names to them, flavonoids and so on. But you don't need to know all of that. You just need to know that to take care of your brain, you want to eat lots of vegetables, especially those leafy greens. And there's some other dietary concerns too. Well, as I mentioned, I'm working with a holistic nutritionist. She presents with me in my sleep course. Our sleep course is Sleep and Be Well. And she and I alternate in our presentations. And she emphasizes fermented foods and a balanced diet and so on. It's all kind of sensible and nothing too radical. But you want to be conscientious about it, I would say. So I'm in the afternoon of life, and I would say I take special care with my dietary habits.
I wonder, what do you think are some important steps that women can take before getting to 50, to
Well, yeah, it's a
have
good question.
a smooth second half
It's a
of
great
life. Yeah.
question. I was just reading some fascinating research. It just came out a couple of years ago. They looked at in Great Britain. They did a study that went on for years, asking retired civil servants or they weren't retired at the time, but eventually they were retired, to fill out questionnaires as the years went by.
Mhm.
And these are called the Whitehall studies. And so lots of good research has been done looking at at this large population of people. It's thousands of people filled out these questionnaires over time.
Mhm.
And what they learned was, just relevant to our conversation here today, what they learned was if you are sleeping uh, less than 7 hours, I think 6.5 hours, most definitely 6 hours or less, if that is your habitual pattern, then you have a 30% increased chance of developing Alzheimer's disease by the age of 70.
Mm.
So, short sleep, as they call it, if you're not getting sufficient sleep, and these days we tend to think that 7 hours is what we want, ladies. If you're not getting adequate sleep in your midlife years, your 40s and your 50s, if you're not getting adequate sleep then, you are setting yourself up for a cognitive impairment in your 60s and 70s. So you don't want to start sleeping well when you turn 60 or 70. You really want to be sleeping well as soon as you can. And most definitely by the time you're in your 40s and certainly in your 50s, you want to be getting about 7 hours a night if you can. Because you see, that's when the brain cleans itself. It's
Mhm.
fascinating, the research we're getting now. There's a whole process that the brain does. It sweeps away all the well, I think of it as garbage, but it has fancy names. But it's just garbage that accumulates in the brain. It looks like thinking, being conscious, is pretty hard for the brain. When we're thinking and being conscious, we're building up garbage, and so then when we go to sleep, especially deep sleep, we're no longer taxing the brain with all this thinking. We're just saying to the brain, well, thank you very much. Now I'm going to go to sleep. We give the brain time to clean itself, but
Mhm.
it needs time. It needs at least 6.5 hours to do a good job. And you want to give it a chance to do that every night. Although, of course, sometimes things happen and you can't get enough sleep. Certainly. But by and large, you want to be going to bed at the same time each night because that tends to reinforce the brain's habits, and you get your 6.5 hours at least. And if you can, aim for 7. So the research simply is that people who sleep less than 7 hours, and especially those who are sleeping less than 6.5 hours, are more prone to dementia. And these are big numbers, a 30% increased risk of dementia.
Yeah.
And then it's even worse if you've been taking sleeping pills. And gosh darn, unfortunately, people get into the habit of sleeping pills, and many people don't realize that you're not meant to take sleeping pills for more than a few nights at a time.
Mhm.
And your doctor may mean well. I like to give everybody the benefit of the doubt. The doctor may mean well, and gosh, you really want those sleeping pills. So the doctor keeps prescribing the sleeping pills. But really, the knowledgeable physician knows that the patient should not be taking sleeping pills for more than a week or two, and certainly not for more than 30 days. And if you're
And
taking sleeping pills for a year or two, you really are running the risk of impairing your brain. That's what the research shows. And numerous studies confirm this now, numerous studies.
and are those different from the ones you could get over the counter, like the melatonin?
Great question. Great question. I don't have much to say about melatonin in this regard because I haven't seen any research about the effects of melatonin
Mhm.
on brain health. So I'm talking now about they call them the benzodiazepines, and there's a whole raft of them, such as Ativan, for example, and the Z drugs, such as Ambien. So we tend to focus on the benzodiazepines and the Z drugs, but some research now showing that the antipsychotic medications can also give us this problem with cognitive decline. And I've got back when I was first training in medicine, I worked for 6 months as an anesthesiologist. I eventually decided that wasn't going to be my career path, but I did put in time helping women pass out. I won't call it sleep. You give them drugs, and it's true for the men too, of course.
Mm-hmm.
You give them drugs, and presto, they pass out.
Mm-hmm.
They are sedated, they are gone, but it's not sleep.
Mm.
And these sleeping pills, they call themselves sleeping pills. I mean, that's what they're selling, aren't they? Oh, you're going to fall asleep.
Mm-hmm.
But it's not the same as natural sleep. It is a
Mm-hmm.
chemically induced state. And
Mm-hmm.
as I mentioned, we want the brain to be able to cleanse itself every night. And gosh, maybe all manner of sleeping pills impair the brain's natural capacity to cleanse itself. So it is true, we know certainly, the evidence is very much there now that the benzodiazepines and the Z drugs uh, put us at risk for dementia. But it's very possible as the years go by that we're going to learn that some of the newer, we call them hypnotic drugs, some of the newer sleeping pills will similarly put the brain at risk, because any kind of chemical that causes us to lose consciousness is not the same as falling asleep.
Thank you for explaining that. So I think a lot of people struggle with sleeping, right? Especially in this state of
Yes,
technology. So how can someone get better sleep?
yes, yes. That is the big question. And all of us in the wellness field, we are all interested in this because we know, all of us know, that life really runs on sleeping and eating.
Mm-hmm. Mm-hmm.
We need to help our clients eat well, and we need to help them sleep well.
Mm-hmm.
Now, just as nutrition is a complex topic and
Mm-hmm.
subject to individual variation, I mean, your genetics might determine that there's certain foods you shouldn't eat, but your
Mm-hmm.
neighbor is well able to benefit from those foods.
Mm-hmm.
Similarly, you may have even a genetic predisposition to certain types of sleeping problems. And
Mm-hmm.
other people, maybe your spouse sleeps all through the night and you have a type of sensitive sleep. So, in the end, we are left with tremendous variety. Now,
Mm-hmm.
those of us in the helping professions, we have to help our clients figure it out, because we cannot just give them a template. There's
Mm-hmm.
not one size fits all.
Mm-hmm.
And the practitioners who maintain that there is one size fits all, I would say, are either ignorant or lying,
Mm-hmm.
because there's so much variation. Some people are having trouble sleeping because their marriage is unhappy and they need to be able to talk to someone and get more grounded in how they really feel about things.
Mm-hmm.
Other people are having trouble sleeping because they have this pernicious habit of, you know, eating big sandwiches at 11 o'clock at night. And
Mm-hmm.
they don't know that's a problem because, gosh, everybody in their family did that, and so on. Some people are having trouble sleeping because the neighbors are so noisy. A very common problem is the woman loves her cat. She loves her cat, and the cat loves to come and snuggle with her repeatedly in the night. So she's being woken up 2 or 3 or even 4 times by her beloved kitty. And
Mm-hmm.
yes, she loves her kitty, but her
That's a
her
good
animal
one.
is well, you get the picture. Yes.
Yeah, yeah.
Because she is an animal too. The poor, the poor human animal needs to be able to lie down and get a few hours straight sleep before she gets up and uses the restroom, and then she goes back and gets a few more hours of straight sleep. And if her kitty keeps waking her up, she's not doing her body and her brain a favor. So, like I say, there's all manner of reasons that people aren't sleeping well. That's part of why I love to help women sleep, because it's so interesting. It's like a detective novel, and you just like it. You really have to think about all the variables that are involved.
It sounds like it, and thank you for giving us those various examples. So as we're coming to a close, is what's your final message to our
Oh,
listeners?
well, I just want to get this word out. On a personal note, my beloved grandmother developed Alzheimer's disease in her 60s. And this was a terrible loss to our family. We loved her dearly. And she took sleeping pills every night of her adult life, as
Mm,
I can remember. And it was only a couple of years ago that I realized that my grandmother had been poisoned by these dratted sleeping pills. In fact, as a child, I was sent to the drugstore to pick up grandma's pills.
mm,
And I just think, my gosh, had she not been taking these sleeping pills, we might have had another couple of decades with my grandmother.
mhm.
So this is a very important issue, and it is kind of getting neglected in part because I don't think society cares as much as it should about women in the second half of life. So that's why I'm here, is just to get the message out. Ladies, your sleep matters.
Mhm.
And don't take the pills. Instead, figure out why you're not getting the sleep that you need and then do something about it.
Thank you. That's a very great message.
Yes, we need our women. We don't want them to succumb to Alzheimer's if we can help it. This is a time, the world as a whole needs the wisdom of older women. So let's get behind it.
Thank you. And how can people find you?
Oh, well, I'm probably the most direct way is joyfulafter50.com. So that's the website that I've got attached to my clinic. My clinic, of course, is meditationforhealth.com, but that serves the general population. My joyfulafter50.com is directed to the women over 50 and the programs that I teach. So I have a Sleep and Be Well program. I'll be teaching with my holistic colleague there. Well, we're in the middle of teaching now, so we'll be doing it again in September. And I'll also be teaching a program for women who suffer from lymphedema. So I've got a few things on the go there. Those courses will be listed at Joyful After 50. And we would love to have any listener who's interested sign on for our email list because I love to send out very interesting emails. I'm not pitching courses and I'm not selling things. I just want women to know of the excellent research that's available so they can wake up to ways to stay healthy and vibrant in the second half of life. So if you want to get signed up to the email list, you could go to joyfulafter50.com. That's either 50 or the word 50, F-I-F-T-Y, joyfulafter50.com. And there's an opportunity there to sign up for the email. We call it the newsletter. And by the way, you'll also get a video of stress reduction too.
Oh, thank you so much, Lucinda. And it was very nice having you on Awaken with me. And thank you so much for all the work that you do.
Why, thank you. I've really enjoyed our conversation, Nick. And as I say, I've been to your YouTube channel and your website and so on. I think you're doing great work yourself, and I'm glad to have spoken with you.
This learning outcome is that studies have shown that sleep helps to prevent dementia, especially for women who are starting to practice good sleeping habits before getting to 50. So be sure to get those shut eyes. Thanks for joining us on today's podcast. If you haven't yet done so, hit the subscribe button for new content every 2 weeks. And be sure to visit my website, awakentoyourpassion.com, for more resources. Until next time, take care.